Hi. So if I say anything that doesn't make sense, I guess I'm going to hold it. If there's something that doesn't make sense to you or you don't understand it, just go like this and I'll go over it again. Lyme disease is interesting. My background was infectious disease, and I trained at the University of California in San Diego with one of the premier infectious disease doctors in the world. He published a book on infectious disease, and we would sit with him every day and look at microbes under the microscope. And when I was training, it was the beginning of the AIDS epidemic, and nobody knew what AIDS was at the time. It was the early 80s, and we had all these people that were coming in the hospital with serious infections, and they were wasted away, and nobody really knew what it was. It then became clear that it was an infectious disease. And I feel like we're in that sort of realm right now with Lyme disease. For many, many years, doctors have recognized that there was this syndrome that after someone got bit by a tick, they might or might not get a bullseye rash, they might or not get fever or chills, and then sometimes 4 to 6 months later, they would start to have joint pain or headaches or neurological problems, and they would get diagnosed with Lyme disease either as a clinical symptom or because they would show up positive on a lab test. Now, part of the problem with Lyme disease is that the insect itself produces a protein which blocks the immune system from effectively taking over the microbe or producing an immune response. So if you're looking for an antibody in the blood to show that you've got Lyme disease, you may not see that antibody, especially if someone is sick and the infection has basically overwhelmed the person. For a long time, the Center for Disease Control, various insurance companies, thought this to be that this was a fictitious diagnosis. And doctors were prosecuted by medical boards. There's a famous doctor in the Northeast named Burscano who was attacked by the medical board for making a diagnosis of Lyme disease and treating people with antibiotics when the medical board said there was nothing wrong with them. And this was not true. And what's happening now is that I think the understanding of the disease is kind of coming up because the number of cases are so many. So Nature's asked me to talk about this today because there are a lot of people who suffer from this. Many of the people who suffer from it haven't been diagnosed properly. We have a number of patients who came to the clinic that have had a diagnosis of rheumatoid arthritis, who don't have rheumatoid arthritis, they have Lyme disease. And the reason why their joints are swollen and sore and that they hurt is because there are bacteria, there are Lyme bacteria or organisms that are in the joints that are producing the syndrome. So I think we need to look at this in a very different way, and I wanted to just kind of track you through the history of it. Lyme comes from the name of a city in Connecticut, Lyme, Connecticut, which was first discovered in 1997. They saw that arthritis, it was clustered, and since it was around this place in Connecticut, named Lyme, Connecticut, they named it Lyme disease. Nobody knew at the time what it was. It looked like it was an infection, that it might be transmitted by some sort of a biting arthropod. That's an insect that bites. And then it was later understood that if you found these ticks that were on people and you cultured the ticks, cultured the part of the tick that bit the animal, or you cultured the GI tract of the tick, that you would find this organism called Borrelia burgdorferi, which is the classic Lyme organism. It is a spirochete, it's a spiral-shaped organism, and I'll show you a picture of it in a minute. And that was the cause of the disease. I don't know if you can see that, but spirochete means spiral-shaped, and they are spiral-shaped. These are very hard to see with a microscope. I'm going to show you some pictures in a little bit of what they actually look like in blood on a microscope. But they're coiled, and one of the characteristics of these organisms is that they're pleomorphic. Pleomorphic means that they can have more than one form. So under some circumstances, they might look like this. Under other circumstances, they might look like just little round things, or longer things like bacteria, or sometimes even longer things like fungi. That based on the circumstances in the body, they can change their form. So those are called pleomorphic bacteria or pleomorphic organisms. Now, one of the things that's often found in patients with Lyme disease is that they have other things which have distorted the terrain of the body. By terrain, I mean the pH and how much protein is sludged in the blood, and how good is the circulation, and how good is the mineral balance, and what shape are the teeth in, and what shape is their intestine in. And what we found in the people that we see who have symptomatic Lyme disease is that there are problems in all of those areas. And I think what happens is that these problems change the terrain of the body so that the body then grows these organisms well and they survive well. And then they sort of add to the mix of what's wrong with the person. So the traditional treatment of this has been to just use antibiotics. And if someone was just bit or just got the infection, antibiotics can be very effective, kill the organism, cure the person in a week or two, and that's the end of it. The problem is that most people who turn up with this disease don't ever know that they got bit, they don't recall it, they don't know what's wrong, they show up later with one of these multiple problems of, I have no energy, I'm exhausted, I hurt all over, I can't think, I feel crazy, my joints hurt, my muscles hurt, and everyone I've seen told me I'm either crazy, or I have rheumatoid arthritis, or I have MS, or I'm just plain nuts. And almost all the people that we see are on psychiatric medication because nobody else knows what to do with them. And so, but they actually have an infection. They actually have an infectious disease. So these organisms are very small, and what's been found out is that the ticks, or probably the mosquitoes, or the chiggers, or the whatever bites you, it used to be said that this was caused by a certain species of tick, and you had to get bit by the tick, and these ticks were found in certain places in the United States. Here's the ticks, and then this was a geographical pattern of the disease. So there was a lot in the Northeast. There's Connecticut up here. There was a lot in Wisconsin, and then there was not low-risk Florida, but we see lots of it in Florida. And I think that these bugs are not only from ticks. I think they can be spread by anything that bites you. Because so few people have the classic, oh, there's the tick, there's the bullseye rash, which I'll show you, and oh, I've got it. They just don't recall it. And so I don't think it's true. I don't think it's understood. But oftentimes these organisms, it's not just Borrelia, it's not just the Lyme bug. It often comes with a bunch of friends. So if you culture the gastrointestinal tract of the tick, or of the mosquito, or the mouth of the biting part, whatever that thing is, you'll find a number of different bugs, 15 or 20 different kinds of organisms. So there's Babesia, there's Bartonella, there's Ehrlichia. These are all, some of them are little parasites, some of them are bacteria. They come along for the ride. And so when we try to make the diagnosis, we do a blood test which looks for about 15 different ones. There's probably more. The treatment isn't specific. And I don't think that the presentation is specific either. Some people say that, well, you've got Bartonella, you're going to have these symptoms. Or you've got Borrelia, you're going to have these symptoms. I think it's a mixed bag. It doesn't really matter, because the way we treat it is basically the same. So there's this symptom complex of all these things caused by probably something that bit you. It isn't known if it can be spread by droplet, like you would cough on someone. It is transmissible probably from a mother to a fetus. And I just had a mother with Lyme disease who delivered a baby, and they did cord blood on the baby, and the cord blood was showing positive in the baby. So that can happen. And that baby needs to be treated. Traditionally, there's 3 stages of this disease. You get bit by the tick, you get a local rash. I'll show you that in a minute. It is supposedly a diagnostic rash. It's called erythema chronicum migrans. Erythema means redness, chronic means it lasts a long time, and migrans means it moves around. Then it goes to multiple organ systems, and then someone with a chronic illness can have all those symptoms that I talked about in the beginning, from central nervous system and mental symptoms to systemic symptoms of pain and arthritis. These are sort of classic rashes. It looks like a bullseye, so it's a bullseye rash. So if you're walking out in the woods and you find a tick on you and you pull it off, and 3 to 5 days later you get one of these bullseye rashes, you've probably been infected and you should get treatment. You should go get some antibiotics, and caught early, it will cure you. So then it runs through this sort of pattern. Some people have fever, some people have aches and pains, they have a flu-like illness. I think a lot of people don't ever get the rash, so it just, the diagnosis isn't made. But one of the causes of Bell's palsy is Lyme disease. So Bell's palsy is a loss of motor nerve function on the 7th nerve, which is on the side of the face, and it would be a droop, or it would be an eye droop. A lot of times this is treated by neurologists or family practice doctors. You have Bell's palsy, it's probably a virus, take steroids for a week, you'll be okay. And the doctor should be thinking, could this be Lyme disease? Were you in an area where you could have gotten bit? Did you have a rash? Did you have any of this other stuff? Because in that case, steroids wouldn't be the right treatment. And then this is the problem. This is the problem one, and this is what we see the most of. So chronic arthritis. I have a patient now who's 11 years old. She presented with a big swollen knee and a lot of pain, and a lot of just basically feeling bad, didn't want to communicate. The first time I saw her in the office, she really wouldn't even look at me or talk to me. She was very withdrawn. And she had been seeing a pediatric infectious disease, a pediatric rheumatologist, an arthritis specialist. She had been diagnosed with rheumatoid arthritis, and she was on a medical regimen for rheumatoid arthritis. The patients weren't exactly happy with the medications that she was getting. She came in for another opinion. I found on our examination that she probably had Lyme disease. I'll show you her blood in a minute and you can see what it looks like. And she has responded very favorably, because I think we actually have what's actually wrong with her, and that she's going to get better. So traditionally the diagnosis is by blood test. As I said early on, the blood test may not be positive, and so you can get fooled. I think there are newer labs now which are doing more refined type of testing to see them, to find the Lyme disease. We find that our accuracy using a certain kind of autonomic reflex testing, a certain kind of a muscle test, that we're able to probably 95 to 98% of the time make the diagnosis right in the office, because we find the organisms. We can find the organisms on a muscle test, on energetic testing. Here there's problems sometimes with making that diagnosis. What we have here's a picture I want to show you. Now this is dark field blood. So this is a drop of blood from the finger of this person. This is this little girl who's got Lyme disease. This is a picture of her blood. Now normal blood looks like this. So these are red blood cells. They should be nice and round. They shouldn't be all stuck together in stacks. This is a white blood cell. These white granules in here are white blood cells that eat stuff that shouldn't be in the body. And this guy's just had a full meal, so he's full. But this blood looks quite healthy, and this is how it should look. If you compare that with this picture, These are the red blood cells. All these dotted things that are all around these blood cells are Lyme bugs that are stuck to the outside of the red blood cells. And you can see this on a microscope. It's called dark field microscopy. And sometimes we see these things actually break away, and you can see the little things swim off.
Those are actually the bacteria?
Those are the bacteria.
They're that small?
Yeah. 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 Yeah.
So are the red blood cells the host to the little bug?
To certain of the Lyme organisms, they are host.
They're the host, so they swim off to find another host?
Well, what happens is when you take the blood out of the body, and now the blood gets low in oxygen, these bacteria, if they're inside, they leave because they're like leaving the sinking ship. There's no oxygen in these red blood cells because now the blood's in room air. And they try to get off. And sometimes when you're watching it, you can see the red blood cell looks around, and then you'll see it sort of go like this, and then you'll see the organism start to come out. It's almost like a balloon with a string coming out. And then if you watch it, you'll see the thing come right out and swim away. So this particular patient's parents had seen this before, and this is an awful looking slide. I mean, this is as bad as it gets. Now, after only a few weeks of treatment, not using antibiotics, this is what happened with the blood. The blood was, we were clearing these organisms out. Okay, and so the blood was much healthier. I was amazed at how fast this went, but that's what we saw. So, yeah.
You said you did that without antibiotics?
We did that without antibiotics. And so I want to talk to you about how we approach this. And as I mentioned earlier, virtually every patient that we see that has chronic Lyme has a bad gut, has low hormones, has mineral deficiencies, has low amino acids, okay, has possibly root canal teeth, high levels of heavy metals in their body, mercury, arsenic, aluminum, cadmium. And they're basically, their body is a kind of a cesspool, and Lyme is just hard. Lyme just thrives in that environment because the body is basically overwhelmed. And I find that most of the time, or every time in my experience, if you take someone that's got all that going on, and you just give them antibiotics for 30 days, or 3 months, or a year, depending on your infectious disease doctors, there's all kinds of different things where this is done, that those people don't get stably better. They might get somewhat better, but they don't stay better. And what we found is if we test them and we say, oh, collect a stool sample, you got parasites in your stool, or fungus, or your digestive enzyme levels are low, or the immune system in your intestine is very low, or you've got parasites or fungus growing in there, and you've got a leaky gut, that we got to fix that. So we do a program to fix that. And then we find out that their adrenal glands are so overwhelmed that their cortisol is low, their DHEA is low, their testosterone is low, and they actually need hormones temporarily to get their body in a state where it can function. And then we look at minerals. Virtually all these patients have low magnesium and low zinc and low vitamin A, and the immune system just doesn't function without these things. So we have to put those back. And then I always do a careful dental look, because if the person has root canal teeth, or areas where teeth were pulled and the bone didn't heal in, these are called Nico lesions or cavitations, that there's bacteria in there and infection in there, or when they have a lot of mercury in their mouth, that these are also burdens on the immune system, and it can only do so many things at the same time. And fighting Lyme disease, it takes a lot of immune effort. So we send them to the dentist, we get their mouth cleaned up. And then when you start to do this, and oftentimes people aren't eating very well. They're just not eating well. And for most people, we do a paleo type diet. I don't want them on any processed food. If it comes in a box or a package, and there's other ingredients listed on there besides the food, don't eat that. So fruits and vegetables, meat, fish, eggs, nuts, seeds, that's the diet. And don't eat processed stuff or chemicalized food. Because oftentimes these foods lead to problems in the gut, they lead to leaky gut, they lead to breakdown, and it's hard to get something better. So we're trying to just get the thing back to how was it? You know, get them sleeping, get them some sunshine, get them light exercise if they can do it, get their gut fixed, get their hormones fixed, get their minerals fixed, get their amino acids fixed, okay? And as that you do that, the person starts to rebuild their body and their immune system, and they get stronger. And then instead of giving them antibiotics, which are a problem, because antibiotic comes from anti, which is, you know, kill, bio, life. And you know that in the cells in your body, if this is your liver cell, inside your liver cell are thousands of little things called mitochondria. Do you know what they do? Mitochondria, oxygen plus glucose into a mitochondria, out comes ATP, which equals energy. The DNA in the mitochondria is bacterial DNA. You know, if you believe in an evolutionary model and things start with one-cell organisms and then they combine and combine and combine until we got a very complex organism like we are now, this was probably something that got assimilated into the body that was an independent organism before, and now in every cell there's 2,000 or 3,000 of these making energy. When you give someone an antibiotic, how many people here have taken an antibiotic and you felt like tired or exhausted? It's because the antibiotic is killing the mitochondria, and the things that are supposed to produce energy can't produce energy because they got knocked off, or they got damaged, or they got harmed. So I try not to do this unless there's some extreme situation or emergency. So we have to find other ways to kill these things. And these things don't like these bugs, these spirochetes or bacteria or parasitic things, they don't like oxygen very well. And so one of the best treatments that we have found is that if we give them high doses of oxygen in the form of ozone. So oxygen by itself doesn't really exist in the environment. They always get paired up as O2. So two of them like to be together because they're neutral together. One of them is unstable, it's radical, it's damaging, it causes rust, it causes injury, and it doesn't really exist in the atmosphere. So it's always paired up as O2. Okay, so that's what we breathe. If you run O2 through a special kind of electrical chamber, you can get it to come out as O3. And O3 is very unstable. It doesn't last very long. But O3, a bacterial, if this is the bacteria, has a positive charge on the outside of it. And this O3 has a really strong negative charge. And when this O3 hits one of these, it rips it apart. And one O3 molecule can kill about 3,500 or 4,000 bacteria within seconds. Not even seconds, within almost instantly. So it's a very powerful antibiotic. It also works on viruses and fungi. So we found if we give ozone in various forms, so if someone's major symptom is a knee joint, which is like my knee joint's killing me, there's bugs in there. And if I shoot ozone in that knee joint, those bugs die, and that person the next day says, whoa, my pain's really better. The bugs died. They're not there to be inflamed. Okay? So ozone can be given in the blood, it can be given as sauna, it can be given rectally, and so depending on the patient's symptoms, we all have all these modalities in the clinic to try to fit the cure to where the problem is. Now the nice thing about ozone is that chemicals and heavy metals, so heavy metal, here's mercury, got a plus charge on it, cadmium, 2 plus charges on it, pesticides, chemicals, dioxin, plus charges. So what happens when ozone hits those? It neutralizes them. So it's sort of the universal antidote to what's wrong because it handles so many things. And so since we've been able to use ozone, it helps a lot. Now the other thing that we use as an antibiotic mainly is silver. Now this isn't colloidal silver, this is actually ionic mineral silver in a water solution. And silver has a very strong positive charge on it. And when it hits this thing, it immediately kills it. And so we can use silver, usually we give it intravenously along with ozone, and it's kind of a 1-2 punch. And since we've been using that as a sort of a main antibiotic protocol, it works really quite well. We've had a lot of people within a couple of months who have been chronically ill for a long time start to feel better and actually get better. They just start to get better. They can tell, they feel it. And what's interesting is that sometimes we have one kid that came here from Phoenix, and his main symptom was it was a psychiatric type symptom. He just was anxious, so anxious. He said, I couldn't live in my skin. I couldn't even be in my body. I was anxious. And they gave me drugs for it, and the drugs didn't make me feel any better. I felt numb, but I just felt the same thing. And after about 6 or 8 weeks of treatment with this, what he said was, I don't feel that anymore. I don't feel that pressure that I can't even be in my own skin anymore. I feel normal again. He didn't have arthritis. He had a little bit of fatigue. So in each patient, it's a little bit different. Somebody had a question back there?
No, I just want to know about the positive charge with the silver. So how does that work with the positive charge on the back?
It doesn't, see, the ozone sort of binds with it and tears it apart. The silver just by itself is so hot, when it hits it, it just breaks it up.
I see.
Okay.
And the ozone and the silver don't neutralize each other?
Very enough.
What's that?
The ozone and the silver don't neutralize each other?
We don't give them the same time.
I see.
Oh,
No, we don't give them the same time.
Okay.
The silver lasts in the body about 10 seconds. So it's put in as a slow infusion, but it isn't given at the same time as the ozone. So once the silver's in, it's done, then the ozone could go in and vice versa. And then, yeah, you wouldn't mix them, they would neutralize each other. Okay.
Will you explain for us how the ozone and the silver are able to harm bacteria and toxins, but not our own cells?
Yeah, see, our body, our white blood cells use ozone. It's really hydrogen peroxide, but which is just like ozone. That's how they kill stuff. So if there's a bacteria and the white blood cell engulfs the bacteria, the white blood cell puts a burst of peroxide, which is just like ozone, and that's how it kills it. So the body sees this as a normal, natural thing. There's ozone in the environment. You know, after it rain, you can smell it. It's a thing that evolutionarily it's been with us the whole time. Now you could poison something with ozone. You could give them too much. So it has to be dosed for the person to an acceptable level. If we dose it too high, what happens is that too many bugs die and the person hurts and they feel terrible. So generally, this is a gradual ramp up, so that we can sort of match the body's load of bacteria with the treatment, so that they don't feel bad. So I'm always trying to run it below a level where they're going to feel bad. And for most patients, that's easily doable. Now, in addition to this, with the diet and with the other supplements, we often give people specific